Hello and welcome to my podcast today. Today I'm going to talk about how I ended up projectile vomiting all over a children's play area, which describes my personal run-in with antimicrobial resistance and why antimicrobial stewardship is so important. So I should probably make this clear before we start. This is not a story of some crazy alcohol-fueled student night out, but a cautionary tale about the use and actually the misuse of antibiotics. And it's easy to think that antimicrobial or antibiotic resistance and looking after those antibiotics doesn't necessarily affect you. But I hope that by using my slightly unpleasant encounter with a very, very bad bug, that I can show you that it's a problem that affects us all and is also something that we can all kind of help change. So I'm going to start by telling you what happened to me. So some years ago, I was on a work placement in Africa, helping with the Ministry of Health's data collection on the burden of schistosomiasis in school children across the country. Now, schistosomiasis is caused by a worm that lives in blood vessels around either the gut or the bladder and can cause many different symptoms such as abdominal pain, fever, and the passing of blood. And those eggs are released into the urine or the poo. And if, like many people around the world, you don't have access to a safe, clean toilet, those eggs can make their way into the water system where they find a snail to live in for a while, and then they burst out of that snail. And if there is a human in the water, the parasite can burrow into their skin and start that cycle all over again. And there's a link to the WHO's website about schistosomiasis in the blog. But that's an aside. It's just a background to the general story. But this work involved going out to schools in different sort of local districts. But to start with, I was based in a hotel in the capital where I was learning from the Ministry of Health team all that I needed to know about the logistics of their schistosomiasis control program. Now, I believe my run-in with the bad bacteria started with an error of judgment on my part, and I was eating breakfast from one of those shiny metal tins with the lift-up lids that is so often served lukewarm and left for many hours in the restaurant, which are the perfect conditions for bacteria to start thriving. But bacteria are, of course, all around us, and we eat millions or billions of them every day in our day-to-day routine. But most of the time, they're completely harmless. Very occasionally, they're not so harmless. And I've got a link to read about the good, the bad, and the ugly bacteria on my blog. It also didn't help in my case that I was coming from a completely different geographical place, so in England, and my gut wasn't used to the local bacteria, which means it was more likely to be able to colonize and cause problems. So whilst we were making our plans and sorting out equipment that we'd need, little did I know that that new bacteria was quietly multiplying in my gut and beginning to cause mischief. So off we went into the countryside, and my bad bacteria came with us. I won't bore you with the details of my increasingly unpleasant symptoms. If you're lucky enough to know if I've had a stomach bug, there's a link to read about the symptoms of food poisoning. I should at this point also clarify that food poisoning can be caused by bacteria, parasites, or viruses, but when ingested with contaminated food, this is often a bacterial issue. After a few days of assuming that this bug would go away and I would get over it, my lovely colleagues started to realize that I was struggling, and so they decided to take me to a pharmacy in the nearest town. And we went in, and I explained my symptoms, and the pharmacist gave me a course of antibiotics to take. And I took them, but it was quite clear after another couple of days that I was still just getting worse. So we then checked into another pharmacy in another town as we were moving around, and the same thing happened again, but with a different type of antibiotic. I still got worse to the point where actually I was really quite unwell, nauseous, and despite barely eating, unpleasant liquids were coming out of places that they shouldn't. Sorry. I stupidly kind of carried on, soldiered on until about a week later when we arrived at a school, and the car ride had made me feel really, really sick. And as soon as I got out of the car, I vomited all over the children's playground and pretty much just collapsed from exhaustion, which was pretty awkward in front of a load of children. It was a very clear signal, though, that something was actually seriously wrong by now. And after spending that day lying in a little sad ball in the back of the car whilst the rest of the team were working, we headed back to the city so I could get properly treated at hospital. I checked into a different hotel to avoid that breakfast, and the nearest hospital to me was a private one. So I went there, I told them about my symptoms, and they gave me some painkillers and told me that I probably had a urine infection, which was surprising considering my symptoms, and that I should come back in 3 days if it hadn't gone away. At that point, I was really quite weak, to the point where I just sort of crawled back to the hotel and slept until one of my lovely colleagues rang me to check that I was okay. And he decided that I was clearly not very well at all, and he came to take me to a different public hospital this time. Whilst I was in the hospital, I waited for 3 hours, and it was hot, and the corridor was packed with people, until a doctor who was clearly rushed off her feet from all of those patients sent me for an ultrasound test. All this seemed to confirm was that my organs were where they should have been, but they decided based on that that I must have had an infection. And then after another quite a long wait, I was prescribed some extremely strong antibiotics, some painkillers, antiemetics, which would stop me vomiting, and then some sachets of good bacteria to restore my natural bacterial community, which not only had taken a hammering from the infection, but also would take a good old beating from the antibiotics that I was about to take. And it's well known that our gut microbiome, so the community of bacteria that live in our gut anyway, is really badly disrupted when we take antibiotics. So I slowed back off to the hotel to take my many, many medications. And actually, for a week, I felt almost as bad as when I was actually sick. The antibiotics were so strong, they actually made me vomit anyway. And I had terrible insomnia for the whole of that week. But after 5 days, I emerged completely weak, a whole stone lighter, but finally feeling a bit better. And while I was sick, I Googled the antibiotics that I had been taking levofloxacin, and I discovered that the dose that they had given me, the doctor had given me, was actually higher than if I had caught the plague, the Black Death, which was ironic considering I was working on plague at the time for my PhD. Now, I've not deliberately named the country that this happened in, and this is actually because it doesn't really matter where I was, because it's a truly global problem and it could have happened pretty much anywhere. Um, and whilst this is just one story about one country and one person, it's happening every day to millions of people around the world. And it's that scale that is the true problem. So none of the antibiotics I got from the local pharmacies worked because the bacteria that caused my infection were resistant to them. So the drugs couldn't kill the bacteria and they just kept growing. It's also important to note that, as I say, it's not only bacteria that can become resistant to drugs, but also viruses, fungi, and parasites can become resistant too. So antibiotics treat bacteria, antivirals treat viruses, antifungals treat fungi, and I'm sure you can guess, antiparasitics treat parasites. And the term for this sort of global resistance is called antimicrobial resistance. I'm talking about antibiotics in my story here because my infection was caused by a bacteria. So what we can look at now is some of the issues that I encountered as part of this story, and how they contribute to antimicrobial resistance. And they're all kind of within the umbrella of antimicrobial stewardship. So how we sort of work with and deal with antibiotics and their use. So the first thing was the availability of antibiotics without a prescription. And antibiotics are available without prescription for both humans and animal consumption in many countries across the world. And this lack of regulation is much more common in lower middle income countries. When we did a study and we looked at the number of countries in the WHO African region, we found that clinical antibiotics, so antibiotics used for people, were prescription only, so regulated, in less than half, 43% of countries. And that number dropped down to a third, 32%, for antibiotics for veterinary use. Which means that in the majority of countries, you can get antibiotics over the counter without having to talk to somebody who is kind of registered. So, if you can access antibiotics without guidance of a trained professional, you risk taking the wrong type of antibiotic, the wrong quantity of that antibiotic, and potentially for the wrong length of time. You're also less likely to be given the correct advice, such as how to take them and making sure that you take the entire course of antibiotics. Generally, scientific research suggests that it's better to finish taking antibiotics to reduce the chances of causing antimicrobial resistance to spread, although some studies have challenged this view recently. Then there's the lack of appropriate diagnostic testing. And in my case, neither of the hospitals did appropriate diagnostic tests, um, either nothing at all or an ultrasound. And in most countries, the gold standard, so the best test for something like a stomach infection, is stool culture, where you take a sample of the poo and culture it on plates. So it's growing the bacteria and then identifying them. And as part of that, you can also identify what they're resistant to as well. The private hospital, as I say, didn't offer me any tests at all. They just assumed, based on what I had told them, that I incorrectly had a urine infection. And whilst the second hospital did do an ultrasound, which is quicker than culturing or potentially PCR, it didn't really tell them anything particularly useful. And it certainly didn't tell them what drugs the bacteria that was causing my infection was resistant to, which meant they prescribed a broad spectrum drug at an eye-wateringly high dose to basically destroy and nuke the bacteria and all of my own good bacteria as well. Broad spectrum antibiotics work against a wide range of bacterial species, and they're often used when the treatment is empirical, which means the doctors base their choice of drugs on their experience of what has worked in the past rather than any concrete test results. There's also a lack of surveillance. So, the pharmacists and the doctors who treated me may not have known which antibiotics the bacteria in my gut were likely to be resistant to. In many countries, there is little data on what antimicrobial resistances are common because they are not routinely collected on a large scale, or it's not centrally reported to the government. This means that, coupled with this lack of diagnostic testing, when the doctors are trying to find drugs to treat people, it is hard for them to choose the right antibiotic. And just to confuse matters, resistance to one antibiotic might be common in one country, but not necessarily seen in another, which means a patient might be treated with a drug the bacteria are already resistant to, or they'll use a broad spectrum antibiotic where a narrow spectrum one might have been more appropriate. The WHO, as well as other groups, have started to create global antimicrobial resistance surveillance programs to help combat this. And an example of that is the Global Antimicrobial Resistance and Use Surveillance System, also known as GLASS. There's a lack of awareness and education. So the pharmacists I saw didn't necessarily know how to treat my infection. In many countries, antibiotics are available without prescription, and therefore the people that are selling them don't necessarily know the best way to treat you. This also includes the treatment of animals as well. And whilst the owner of a pharmacy may have to have a license and a formal education, that doesn't necessarily mean that the people working in the pharmacy do. There's also a lack of education or awareness on the patient's side as well. Even if you live in a country where antibiotics are regulated, if you go to a doctor with a chest infection, say, you expect to be given something to treat it with, as otherwise you probably feel like it's a wasted journey or that the doctor isn't really taking you that seriously. The doctor or pharmacist can feel pressured into giving you treatment where you don't need it. And many studies have shown that education programs and awareness campaigns for both medical staff and the general public, such as the World Antimicrobial Awareness Week, can reduce the use of antibiotics or inappropriate antibiotics. Then there's the cost. And whilst thankfully I had travel insurance to cover the costs of my many visits to pharmacies and hospitals, most people are not so lucky. In many countries, the cost of seeing a doctor to get medical opinions and most appropriate diagnostic tests can be extremely expensive. Just look at the USA. And these economic barriers to healthcare disproportionately affect poorer communities. So, in countries where you can access drugs without seeing a qualified medical person, it makes sense that many people just buy drugs over the counter purely for the cost. Another issue is that pharmaceutical companies often give pharmacists and doctors bonuses for prescribing certain drugs, meaning they might be biased when it comes to the drugs that they give you. There's also the use of antibiotics in animals, which is thankfully less common now than it once was, but antibiotics used to be used, and still are, in farm animals to aid quick growth and maximize profit. Other potentially suboptimal practices include preventative or prophylactic treatment, which includes treating a whole herd or flock of animals when only one of them or a few of them has an infection, which is hoped to stop it spreading. The WHO has now published guidelines to try and curb the inappropriate use of antimicrobials to help reduce the spread of resistance. So the important thing is, how do we try and change this? How do we try and prevent antimicrobial resistant spread by improving antibiotic and antimicrobial stewardship? It may sound scary, what I've kind of mentioned, but there are some things that we can all do to reduce the spread of antimicrobial resistance and keep our antibiotics safe. Some of these things, of course, will involve changing policy, which would need significant government investment, and it's important to do research to identify the best ways to combat antimicrobial resistance to inform these changes appropriately. So this is something I'm involved in and I'm quite passionate about. And we're looking at how the changes in infection prevention and control policies and antibiotic stewardship on COVID-19 wards have affected the spread of antimicrobial resistance. And you can read about this project in my other article, Has the COVID-19 Pandemic Lit a Fire Under a Hidden Pandemic? There are also many things that you or I can do in our daily lives to try and help fight the spread of AMR, though. So a list of these things. There's also web pages, of course, but education is really important. And making sure that you are aware of how resistance spreads is the best tool in our arsenal of weapons to fight it. There are loads of good sources of information, scientific papers, plain language websites, and governmental campaigns. And two good places to start include the World Antimicrobial Awareness Week campaign and the REACT Group's website. When you do need antibiotics, it's good to use them appropriately. And the WHO has guidelines on how to do this. There's a link on the website. And you should also try and get vaccinated for as much as you can, because by reducing the diseases you might catch, you are reducing the amount of antibiotics you are likely to need in your lifetime, and also reducing the amount of times you might go to a doctor and then potentially be given the wrong treatment. Good hygiene is also really important. And this is kind of in a number of ways, by preparing food safely and not eating day-old breakfasts, washing your hands more often. You're less likely to become infected in the first place by sneaky pathogens trying to take control. Cleaning skin wounds, for instance, also helps prevent infection spreading. COVID-19 has obviously introduced the world to lots of good practices for reducing the spread of respiratory diseases, such as the use of masks and physical distancing as well. So it's good to kind of consider these things. We're far more likely to be able to control antimicrobial resistance if we all work together. And prevention is better than cure, because that way, if you don't get an infection in the first place, you will never need to use antibiotics. So let's hope I can put this into practice the next time I come across a bad bacteria. I'm hoping that I will be more prepared to fight it properly and less likely to end up entertaining some school children in a playground.